Good evening. This is Dr. Klein. This is the 15th of April, and I was having trouble getting my camera started with this button that doesn't work half the time. So let me put my microphone on so you can hear me better. Today we're going to discuss hyperalgesia. It's a topic that's come up before the FDA. And the FDA wants to put a warning on opiates about hyperalgesia. They have 32 reports. That's not very many. To give you an example, the number of reports they had of adverse effects of Humira, which is a powerful drug used for rheumatoid arthritis, they had 30,000. So 35, I'm surprised they're even dealing with it. But the FDA is coming under fire for the opioid crisis. They were accused of causing it. Letters said that Janet Woodcock, who turned down the PROP, and that is Physicians for Responsible Opioid Prescribing, turned down their request to limit dosages. The thing of it is, we only have one drug that works for severe pain. Just one. FDA has only approved one drug for severe pain, and that's the opiate group. There are no backups. So when you're faced with a situation as a doctor, as I was in the early 1980s, when the first drug came out for AIDS, it was the only drug. So of course we used it. It didn't matter what the side effects were. We just told the patients, these have these side effects, it's up to you. So opiates have side effects, not very many. It's one of the safest drugs we use. But of course it causes addiction. But remember, we've said this before, the addiction is rare. It occurs in less than 1%, and you'll know right away because you fly to the moon on your first pill. So you can stop the horror. You can't stop the addiction, it's genetic. You can stop the horror. So what I wanted to do today was just kind of bring you up on some things that are going on, some polls that we've done. For those people with CRPS, chronic, or rather complex regional pain syndrome, we asked, did ketamine work? Because a lot of people are getting ketamine. About half said it worked well, and 30% said they would not recommend it. So it's up to people to decide themselves. These are my new poppy flowers. Do you think the average person knows that an opioid is basically a pain medicine? Pain medicines are opioids, and all opioids are pain medicines. The only exception is Tylenol is also a pain medicine, but it's really not worth considering for serious pain. So we can substitute the word pain medicine for opioids. How many people do you think know that opioids are pain medicine? 20% said the people didn't know. 60% said they did know. Gabapentin has now become the go-to pain medicine since the CDC took opiates off the list for primary pain medicines. It's not approved by the FDA. Still, we asked, does it work for you? And the question was, does it work well for you with your pain? The answer was 9%. So you got a drug that only works 9% of the time. It's even being given to dogs because now the veterinarians are under pressure because they're afraid that if they prescribe opiates for their dog, the owners will take it because they're all addicted. Addiction phobia. How many people are addicted in the United States? 3 per 1,000. Also, 40% said that gabapentin had intolerable side effects. I asked nurses in our group of pain patients, in your experience, how many post-op patients need pain medicines? And the answer was more than 90%. Narcan. For you people pressured into buying it in case you overdose, did you decline and get or did you pay for it? So 30% declined. Insurance paid in 40% of the time, and 26% paid for it, 4% over $100. Narcan is to reverse opiate overdose. 95%, just checking the time here, 95% of people who overdose are people with heroin disease, not people that take their medicines from their doctors. This is a huge, huge myth. Of the 100,000 who claim to be drug overdoses by the CDC, they have not released a figure of how many they think are coming from doctors' prescriptions. Our estimate is very, very low, 5% or less. Well, we have time for one more. How many of you have distressing muscle spasms, and that's a reason to use benzodiazepines? I was kind of surprised by this. 91% of the 100 people that responded said they had serious muscle spasms. And I saw a show about Lady Gaga, and there were some segments where she was talking about her fibromyalgia, and what were the problems? Huge stem to stern muscle spasms. So people with, according to this, it's 90% have muscle spasms. Most everybody should be on Valium or other benzodiazepines, and probably also a muscle relaxant. Doctors are being arrested for treating with the Holy Trinity, which I think is kind of a blasphemous term, which is opiate, muscle relaxant, and a benzodiazepine. But the National Pain Council has not found a single problem with that, but doctors are being arrested. Okay, time to go. Good night. I'll shut off.